Hi, today I'll be talking about periods in this session. So, periods or the menstrual cycle, where the woman bleeds every month, where the duration of the cycle may last from 28 plus or minus about 5 to 7 days each cycle, and depending on the variability of the cycle, there could be various causes affecting her periods. So, a woman once she attains menarche until menopause, she undergoes a regular menstrual cycles. So, what are these cycles? What causes this menstrual cycle? What are the hormonal changes that is responsible for it? We'll be seeing today. Um, Once a female attains menarche, that's when her periods start or her regular menstrual cycles start. So it doesn't mean with the onset the periods get regularized. So this has a connection with the brain where certain hormones called FSH and LH released from the brain, which acts on the ovary, which results in the development of the egg. Further, the egg and the uterus prepares itself for pregnancy, and if a woman does not conceive, then the bleeding starts off. So this cycle keeps continuing every month. So once a girl attains at the time of menarche, in initial few years, up to 12 years, a female can have irregular cycles that is still considered as normal. This is because it takes at least 2 years, 1.5 to 2 years, for a female to attain maturity of the HPO axis, that is nothing but hypothalamo pituitary ovarian axis, meaning until the hormonal levels are stabilized within the body from the onset of menarche, we cannot consider that she is having any irregular cycles, or there could be a pathological cause causing it. So until about 2 to 3 years, it is still considered normal. If a woman gets and if a female gets delayed cycles, it is accepted. Whereas once she attains, gets into the reproductive age group, that is after 20 years and until 35, 45 years of age, 40 years of age, and this is the time where she needs to be aware of the irregularities or abnormalities of the periods.
As I told you, on the first day of periods, the ovaries contain multiple of follicles, and these are the follicles which contain microscopic eggs inside. So these are now there are about an average of 10 to 12 follicles on each ovaries when the woman is less than 35 years. Body brain produces hormones called FSH and LH, which acts on the ovary, and on the ovary, when it acts, it causes release of, it causes the development of the follicle along with the oocyte. The oocyte is placed inside the follicle, so it starts growing. So every cycle, though there are multiple eggs, it's only 1 or 2 eggs that grow in everybody. So once the follicle grows, as and when it starts growing, it releases a hormone called estrogen, and this estrogen has got multiple effects on the body, and also it has an effect on the inner lining of the uterus, which is called endometrium. So in response to the estrogen, the endometrial lining keep on growing. It makes the endometrial lining grow. So for the egg to attain its maturity, it takes about 14 to 15 days time. Until then, the estrogen keeps on rising in the body. Once it attains maturity, there is sudden release of the hormone called LH from the brain, which acts on the follicle and causes the egg to release. So that means the follicle which is containing the egg ruptures and the egg gets released out. And once the egg is released, the follicle or the in the ovary starts producing a second hormone which is called progesterone. And this is necessary to prepare the uterus for the upcoming or the coming up pregnancy if the woman conceives. So the egg, once it is released, will go and sit inside the tube. That time, if the couple keeps contact, and the sperms travel inside, enters the tube, convert into pregnancy embryo, and then comes and attach to the uterus after 5 days, leading to pregnancy. Suppose if she does not conceive, the progesterone secretion will in the follicle, which I told will start after ovulation, will keep on will increase, and then it will start reducing when there is no pregnancy. And once it reaches minimal levels or it drops down significantly, the inner lining of the uterus cannot grow further, and that's when the woman will start bleeding. That is called the bleeding phase of the menstrual cycle. So and each cycle has got the bleeding phase. There is a follicular phase where the first 15 days of the cycle egg growth is expected to happen, and the second half of the cycle, that the next 15 days of the cycle, which is called the secretory phase, and then suppose if there's no pregnancy, bleeding happens. So this is how a normal menstrual cycle keeps on happening. So now we need to see when do we call the menstrual cycle as normal or abnormal. Are there various classifications to call it abnormal? A normal menstrual cycle is one where the duration of the cycle lasts for between 21 to 35 days. On an average, most of the people have it between 28 plus or minus 2 days, but anything that is ranging from 21 to 35 days cycle is considered as normal. The duration of bleeding within 5 days, having less than 80 ml of flow is considered as normal flow. Suppose when do we call it abnormal? So abnormal is considered when the duration of cycle either increases beyond 35 days, where it is called as oligomenorrhea, where each cycle might come once in 40 days, or sometimes 2 months, sometimes 3 months, or in some people maybe only after taking medications. It can be seen in patients with a severe form of polycystic ovarian syndrome, or in those who have endocrine dysfunctions like hypothyroidism, or in cases of elderly ones and the woman is in her perimenopausal age group. Then also we can have irregular cycles or oligomenorrheic cycles. Similarly, when a woman has shorter cycles, less than 21-day cycles, then that is called as the shorter cycles, and the most probable cause for it is when the ovarian reserve is dropping. That's when the cycles starts becoming shorter and shorter. So your elderly age group, we see shorter cycles. Next, coming to menorrhagia, meaning heavy menstrual blood flow, when the flow is more than 80 ml, or that can be identified when a woman is changing more than 3 to 4 pads per day, history of passage of clots, and duration of periods lasting for more than 7 days. In such conditions, they are called as menorrhagia. Whenever there is excessive menstrual flow, the probable causes would be because of either multiple fibroids, endometrial polyps, or having the hypothyroidism, or in cases of endometrial hyperplasia, or even in PCOD. All these patients can present with menorrhagia. Similarly, there's something called hypomenorrhea, where the blood flow is very minimal, lasting for a day or less. In such women, the most probable cause would be tuberculosis, where it has got affected the endometrial lining, and thus the growth of the lining is not happening, resulting in reduced blood flow. And also in cases those who have had multiple DNCs, where the endometrial basal layer is completely damaged, or any intrauterine additions because of either surgeries or tuberculosis can present with hypomenorrhea. So once a woman presents with any menstrual irregularities, most of the time it could be associated with a pathological cause behind. So just based on the history, we can get a fair overview of what could be the possible reason. And also knowing the cycle exactly will help a woman to know the probable day of ovulation. To identify the exact date of ovulation, one should monitor the duration of the cycle, and whatever is the duration of the cycle minus 14 days from the last day. Suppose it is a 30-day cycle, minus 14 days will tell her that will be the day 16 will be her date of ovulation. In case of a 28-day cycle, minus 14 days, that is the 14th day, will be her date of ovulation. So always the second half of the cycle remains fixed. Only it is the first half of the cycle which can vary from person to person. So this also gives an overview of the menstrual cycle and the possible date of ovulation. So this is just a brief overview of menstrual cycles, and thank you.